Hi, my name's Amy Francie. I am a registered nurse in Minnesota. I have been a nurse for 14 years, almost 15 years. I initially started out my career in adolescent psych. I was there about 6 months before I wanted to do more acute care experience. So I had moved to a step-down tele unit, and then I went to ICU. I spent a majority of my career in the ICU up until about I think it was 2018, 2019. I moved to peri anesthesia, where I pre-op and then recover surgical patients. The medication or like pharmacology stuff that I give, I mean, when I was ICU, it was countless drugs. You know, I could have a patient that would be on 5 to 8 different drips, plus I'm giving bolus meds or anything like that. And then in PACU, I'm obviously giving narcotics out like it's candy. Let's see. So the NP concentration I have chose is to be a mental health nurse practitioner. If you would have even asked me a year and a half ago if I would have ever gone back to school, I would have said absolutely no way. But my oldest son, who is 8 now, has had a lot of behavioral issues since he was probably 18 months old. We'd been begging for help for years, and about a year ago, I had to bring him to the ER for suicidal and homicidal ideation, and he had an inpatient psych stay for 6 days. And that is the extreme we had to go to get help for him. He ended up having to be in day treatment, and we finally got an official diagnosis 6 months ago of autism. But I mean, it took us years, and we've been fighting for him and advocating for him for years. But the problem is there's just not enough mental health practitioners for the demand that there is, especially when it comes to kids. So that's why I decided to go back for this, and I can be a part of the solution. Like I said, I live in Minnesota. There's a couple limitations for Minnesota state laws when it comes to prescriptive authority. So there's a transition to become independent in prescriptive authority. So any APRNs in Minnesota, whether it's a nurse practitioner or a clinical nurse specialist or a nurse midwife, they need to have a transition period of 2,080 hours, so equivalent to full-time for 1 year, working under an agreement with a licensed physician or other experienced APRNs. So having that 1 year under your belt can help you focus on like decision making and prescribing practices for whatever patient population you're going to have. So only after you complete that 2080 hours can an APRN then prescribe independently without any physician oversight. There's also the other thing was for limitations. There's a requirement to register with the Minnesota Prescription Monitoring Program. So all APRNs with prescriptive authority for controlled substances. So you're looking at people who give pain meds and mental health medications, any psychiatric medications, or suspected substance misuse. Those all have to be monitored through the prescription monitoring program. So it tracks the prescribing and dispensing of controlled substances. So it's usually at Schedule 2 to Schedule 5. And like I said, that is definitely in certain situations when it comes to pain medications and psychiatric meds. I think that's about it. I am excited to work with all you in this class. Thank you.